I think people, especially like men, when they're in their 20s, 30s, and 40s, they worry about like developing a double chin and that they can be really self-conscious about that. So I'd love to hear your insights on first, what causes that? And then how can people prevent that and then fix it?
So there's a lot of factors. One of the interesting things is if you see a guy wearing a goatee, oftentimes that goatee is meant to basically hide either a double chin or a fairly weak chin. And that's why if you see celebrities sometimes who shave their beard or shave their goatee off, you look at them and go, oh my gosh, they look so different than I would expect. And so, yes, this is an area that definitely is an area of concern for a lot of men, especially when you start entering in your 30s. Part of that, I think, is because our skin starts to get a little bit looser as we enter our 30s. We start to notice potentially fat pockets that maybe we didn't notice before. And for a lot of people, whether it's men or women, they find that it's not as easy to bounce back from a poor diet and a poor lifestyle after you exit out of your 20s. You know, I think so many people in their 20s, they can binge drink, binge eat, and it seems like the next day they bounce right back and they look fine, they feel fine. But once you hit your 30s and definitely your 40s, that starts to change. So what causes a double chin? There's two things to consider with this. The first thing is that obviously there's fat. There's fat deposits there that some of us, we gain actually genetically. I do believe that we inherit certain fat depositions from our parents. So if, let's say, your dad has a double chin, then there's a good chance you'll have one. And then that would be combined then basically with loose skin. And obviously the skin getting looser, you start to notice it more. And then the final thing is loose muscle. There's some people that have muscle called the platysma, and this is a muscle of the neck that tends to droop. You know, you may have friends who are really thin and you look at them from the side and they don't have that 90-degree angle to their neck, even if they're 18, 20 years old and they're thin, it kind of is a line going from their chin down to, let's say, their Adam's apple. A lot of times that's actually due to droopiness of the muscle. And that too, I believe, is inherited in most cases.
So what can somebody do from a prevention standpoint? I mean, I know, like, for instance, if somebody's trying to get rid of like loose skin or fat on the arms, they could do, you know, some arm exercises to build some muscle to help like hide that or help, you know, have the muscle show more than the fat. So what can you do like to both prevent and then also to like fix your jawline?
I mean, prevention is going to be simple things that are not going to be necessarily super, super effective if you truly have extra fat there. So for example, using a retinol cream at night. Okay, that's going to help keep the skin nice and tight. Using peptide creams, that's going to do that. Obviously, a healthy diet, you know, eating sufficient amounts of protein so that the collagen of your skin does not break down as quickly as it would otherwise when you're in your mid-20s. But what you can do, there are some active things you can do to slow it down other than just creams and lifestyle changes. And so there is a treatment called Morpheus 8. It's a treatment basically where you do what's called radio frequency microneedling, and it's a deep heating of the skin. So let's say you're in your mid to late 20s or in your 30s, you're starting to notice things getting a little bit droopy. Then doing a treatment like that, it is done in an office setting. We do usually recommend 3 treatments spaced every month or 2 apart. But what that does is it helps to cause the collagen in the skin to tighten. There's maybe a day or 2 of redness afterwards, but super, super popular treatment. No visible scars, nothing like that afterwards. It's completely non-invasive. So that's one thing you can do to help tighten up the skin or keep that skin nice and tight is Morpheus 8 combined with good skincare. As far as fat, though, if you've got fat deposition there's no real way that you can prevent that. You know, once again, a lot of that fat deposition, unless you're just, you know, obviously significantly overweight, a lot of times when you do have a double chin, and if you feel that you're at a good weight, you're healthy, you may not notice, you know, fat deposits elsewhere, it's just in that area, then that's probably is inherited from your mom or your dad. You know, look at your mom or your dad and see which one of them has it because you most likely got it from them. Now, to treat that, number one, prevention, there really is no great way to prevent it, but there are some non-invasive ways to treat a double chin. There is a couple of fat-reducing treatments. Cool Sculpting has one. We have one called Sculpture that uses a laser to basically heat the fat to reduce the fat there. And you can do injections of Kybella. Kybella is an FDA-approved injection. It contains a substance called deoxycholic acid. And this is a naturally occurring substance in your GI tract that basically dissolves away fat. So that's FDA approved. You can actually inject that into the double chin fat. It is approved for that area, and that will gradually melt that fat away. And so if you're dealing with the double chin, prevention is tough because most likely, unless you're just overweight, in which case weight loss can help. But if you're not, and it's from your parents, then to deal with the fat, you'd want to actually undergo some type of a treatment. And the good thing is it doesn't have to be liposuction.
And so you said like one of the things that people do to hide that is they grow out a goatee as a sign for hiding the double chin. Like, is there anything else that somebody can do? I mean, let's just say there's a woman listening to this or watching this and like, oh, like I'm worried about this as well. And obviously I can't grow a goatee. Like generally, what are some other things that people can do?
Some other things you may look at is sometimes when you've got, let's say, fullness in the chin area or in the neck area, essentially below the chin, sometimes it's a sign that the chin may be a bit on the small side. And so having a recessed chin or what we call microgenia, a smaller chin, that may actually accentuate the fullness underneath it. And so one thing that we do is I'll actually take a picture of my patients from the side. We call it a profile. And in general, if you're a male and you take a line coming from the front of the front part of your lower lip, going perpendicular down to the ground when you're in that profile view, like looking straight across, your chin, the front part of your chin should project to that line. Another way to say it is that the front part of your chin, if you're a male, ideally should project to the front part of your lower lip. If you're a woman, then cosmetically, it should be a touch behind it is what we in general see as a quote unquote aesthetic ideal. That being said, obviously, there's people who look great and they have smaller chins. That's fine. But in general, that's what we look for. And if you are significantly behind that, so like if you're a guy and your chin does not project to that line and is way behind it, then that might be a sign, once again, that your chin may be on the smaller side and it may be contributing to the double chin appearance. In a female, once again, it doesn't have to project that far. If you are significantly, though, behind that, once again, that could be the same thing with a female. And interestingly enough, what we find is that in people who have smaller chins, the chin tends to draw attention to it, and it actually detracts from the other parts of your face that you may normally pay attention to, like the eyes and the cheeks. So nobody is known for having a good-looking chin. Okay, when you think about it, like do they ever do like Hollywood roundups of the most attractive chins? No. And the reason why is because a chin that is ideal is one that blends in and it allows the other features of the face to stand out, like pretty eyes, striking eyes, high cheekbones, that type of thing.
When you do hear a lot about somebody having a striking jawline, right? What are some like habits of somebody you think that has a striking jawline outside of their genetics?
Yeah, I mean, a lot of this, once again, you are to an extent born with. A lot of it has to do with weight, too. Obviously, if you're holding extra weight, that is going to soften your jawline. There are some things that people do that are really interesting. There are people who will do jawline strengthening types of exercises where they essentially are chewing on these types of devices. You see that on social media quite a bit. The problem with, let's say, a device like that is that you are going to strengthen your masseter muscles, which are the muscles on the side of your jaw. Now, if you're a male especially, and you're looking for a more chiseled jawline, one that actually is fuller on the sides and wider. So let's say you have a very narrow, thin face. Is it possible that by increasing the width of that masseter muscle, which is on the side of the jaw, that could help improve it? I mean, technically, I guess yes. Most people find, though, that strengthening that muscle and making it bigger, it does the opposite. It causes people to feel as if they actually stick out too much. And so in my office, occasionally we'll actually inject botox into that muscle in some people to actually slim that down.
And getting into one of the other pain points on the face, on the head specifically, like, hair, I think becomes something that both men and women become super insecure about as they age. But men obviously get more insecure about that losing the hair, and then women, I think it's more leaning towards like the color of it, right?
But women thin as well. That's, I think, a lot of people don't realize that women deal with thinning hair. It's not as genetically mediated as it is with men, but a lot of women, especially after they get through menopause, they deal with thinning hair, and a lot of younger women as well.
And so I look at a guy like we watch a lot of like Gordon Ramsay, and like, dude, that guy's got like a nice head of hair, right? He's like, I mean, he's an older guy. And so like, if a guy is like listening to this or watching this and they want to like maintain a full head of hair, are there somebody that maybe doesn't, they're losing their hair, what can they do to reverse that?
So a couple of things you need to look at. If, some of this is genetically mediated. And if, let's say, your father is completely bald and his grandfather's completely bald, and you're noticing your hair is rapidly thinning, especially when you're younger in your 20s, well, that may not bode well. And it may be hard to really fight that process off as much as you would like to. If, however, you're noticing your hair thinning, which is very common in men, especially as they get older, I looked at some statistic recently. It was something like 80% of men over the age of 50 has some type of thinning of their hair. I think that's very, very common. There are a lot of things you can do. So usually with that type of situation, I start with the most natural, easiest things, and then we go to more advanced after that and like pharmaceuticals. So the first thing, if you're noticing your hair is getting thinner, let's say over the last 6 months, the big question I would have is, have you had a lot of stress over the last 6 months? Okay, because there is something called telogen effluvium, and this is a situation where if your body gets stressed, you can find that you lose your hair. And so if that is the case, let's say you're at a very stressful time in your job, I see this in patients who have surgery. They have surgery, and then afterwards they say, geez, for the last couple of months, my hair's getting thinner. Most likely this is due to the trauma and the stress of those events. And so what can you do? Well, very straightforward things, meditation, yoga, going out to exercise, whatever it works for you to reduce your stress, that can definitely help with the hair. That whole process is many, many months because your hair goes through different growth phases, and the telogen phase can go for a couple of months. And so be patient if that's part of the case. So that's really one thing. Another thing you can definitely do is take a nutritional supplement. The one that I recommend is Nutrafol. You could see a functional medicine doctor. You could get your labs drawn to see where you may be nutritionally deficient. That can be very expensive. And if you, let's say, don't have access to a functional medicine doctor, or maybe a dermatologist who'd be willing to do those labs for you, then one simple thing is to get an all-in-one type of a supplement like Nutrafol. And that's a super big seller. We have it on my online store, younbeauty.com. They make one specifically for men. That's one of the things I've been taking here for the last couple of years. So supplements, I think, are helpful. That's kind of one of the first stages of treatment. The next stage would be red light therapy. And so they have these helmets that have basically low light lasers inside of them. And those lasers, essentially, they cause your hair to go into a growth phase. And there have been a lot of studies showing that those laser helmets do work. Also topicals. There's some topicals made by natural companies, topicals that contain things like castor oil, coconut oil, rosemary oil. None of these have a lot of science to back them up, but they just haven't had a lot of studies. And a lot of people do swear by all of these as ways to help to thicken the hair. So that would be another thing you can do. Now we're going from there. Okay, so like natural is going to be stress release. It's going to be supplements, red light therapy or low light laser therapy helmets, and then considering a natural topical. But if you want to go for something that's going to be more potent, then there are other things you can do. And so the first thing to consider is minoxidil. It used to be prescription. It's available over the counter now. Usually the one I recommend is the foam, minoxidil foam, and you can get it even at like Costco in large quantities. So that is a very basic thing to use. Second thing is some doctors are prescribing minoxidil orally. I was talking to a dermatologist the other day, and that's what she prescribes for people. And the only thing with that is that you may find that you grow hair in other parts of your body that you may not want as much. And then the final thing you can consider is something called PRP injections, where you draw your blood, spin out the platelets, and then inject that into the scalp to help grow hair. So that's kind of the direction I would go, starting with simple, less expensive, easy, and then proceeding more towards the pharmaceutical and then the interventional.
Right. And I would imagine at a certain point, the prevention doesn't work as effectively and you have to engage in some sort of treatment. One of the things that, I've worried about over the years with treatment is like once you start taking one of these prescription treatments, do you have to keep taking it, or is it something that can only be taken for a few months?
You do. With any of these treatments, the problem with thinning hair is it's progressive. And in the end, you're going to be fighting that process off. And at some point, you may get to a point where you say, look, I'm tired of fighting it. I'm just going to let the process play itself out. I do think that happens. I'm 52 and I am fighting that process. What do I do every day? Well, I do meditate, not every day, but I try to meditate. I do yoga. I do apply minoxidil. Lately, I've been doing that. I have done other things as well. I do have a laser helmet, and then I do take Nutrafol supplements. And at some point, I'm 52. Maybe when I'm 60 something, I'll be like, hey, we'll let the hair go. I don't know. But, years ago, Doug, my son and I both got buzz cuts. And I realized that I do not look good bald. Yeah, this cranium is not a good bald cranium. And so I'm going to try to keep my hair as long as I can.
So Nutrafol was the holistic supplement company you recommended?
Yeah, that's really the big one. There have been other ones in the past. Like I said, you really have two options that I would say is if you have funds, you have access to a functional medicine doctor or a dermatologist who is open to doing a bunch of lab tests to see what you may be deficient in. You can do that. For me, I don't know. I'm busy. I'd rather just take the Nutrafol. I know it has everything in it that I may need. It also works kind of well as a multivitamin anyway.
Great. And then one of the other things you hear a lot, I've been told at least, is that you should stop wearing hats to protect the thickness of your hair. Is there merit to that?
There is. So there is something called traction alopecia. Traction alopecia is what happens when you're pulling a lot on the hair and you tend to pull that hair out eventually and you can lose it in spots. You see that a lot in women who are pulling their hair out back into buns a lot. That can create some traction alopecia. And then especially in men who are wearing hats a ton, that definitely can do it. Traction alopecia is something where the problem is it's not a black and white situation. It's not like, oh, hey, I wear a beanie every day. Is that okay? Versus how about a baseball cap? Like, it's a known situation. It's a known condition, I guess is a way to explain it. But it's not like it's a black and white thing of, okay, if you wear a baseball cap 2 days a week, then you're going to get traction alopecia. It really, you also have to consider it's the pulling of the hair that's the issue, not the covering of the hair.
And then while we're on the face and the head, let's talk about wrinkles. I think that is something that people get concerned with as well as they age. Talk about prevention of wrinkles, and then once people start to develop them, what can they do from a natural perspective?
Yeah, obviously, you want to consider sunscreen, especially if you're going to be out. A lot of guys, they have jobs that are outside. Those are the big ones that you really want to protect your skin, not only for wrinkles, but also to prevent skin cancer. A lot of men, and I've got friends like that. I've been like this back when I was in high school. We think, okay, it's not going to happen to us. It's fine. I don't want to put stuff on my face that feels greasy or whatever. And I get it. I totally get it. Like, it's not what we ideally want to do. But if you're going to be out, it is so important to use some type of sun protection, especially if you're going to be out for long periods of time, because I can't tell you how many guys that I see who are in their 50s and older who develop skin cancers of their face. They get that skin cancer removed and they end up with a huge hole in their face. Now, yes, we can try to reconstruct that hole, but to do that creates other types of deformities elsewhere because we got to move tissue in to try to reconstruct it. It is important, some people say, well, then I just will leave everything alone. I'll ignore it. The problem is most of the skin cancers that may occur on your face are not going to kill you. But the problem with these cancers is that they keep growing and they grow and they grow, and you can't ignore it because eventually it's just going to be a big hole in your face that never heals and it just oozes. And like now by then it's, now you got a big, big problem. So wearing sunscreen, at least SPF 30, especially when you're out. If you've got a desk job and you're on the inside and you're not, sitting outside and you don't want to wear sunscreen, I get it. Like, I'm not a dermatologist who puts on sunscreen every morning and then sit like in a basement or something. Like, no, but if I go out for a period of time, then I try to do that. As far as other ways to prevent it, with men, you always want to be simple and you want to be effective. A lot of men, we have thicker skin than our maybe female counterparts, sometimes more oily skin. And one simple thing is to use either a retinol or a Retin-A or tretinoin. Okay, so if you have access to a dermatologist, you can get prescription strength tretinoin. If you don't, you can buy a retinol online. We have one at my website, younbeauty.com, or Youn Beauty Retinol Moisturizer. If you pick one anti-aging cream, all you have to do is apply it at night, once a night, and that's all you have to do, and you're going to be way ahead of everybody else. And that's really going to be good for helping to protect your skin, as well as even reverse some of the aging as well. And bonus, studies show that prescription strength tretinoin can even reverse early pre-skin cancers. And so if you're a guy, and let's say you're listening to this, you're 30s, you're 40s, you've been working outside a lot, you never really protected your skin, you've had sunburns and stuff, then it's not a bad idea to start yourself on either retinol or prescription strength tretinoin, because you never know what potential early pre-skin cancers that may get rid of for you.
I saw a headline this morning actually that said, I think it was from ABC, that said young people are fleeing from fillers and going for more facelifts. Why do you think that is?
I'll let you in on a little secret, Doug. There are mainstream media outlets that every year will interview plastic surgeons about what the new trends are going to be in the next year in plastic surgery. And As a plastic surgeon, I have 5 injectors at work in my office, 5 or 4 or 5 injectors. If they do a treatment of Botox, we'll charge maybe $500. And as a practice, I may make $150 profit off of that. In that same amount of time, if I perform, let's say, a blepharoplasty on a patient, this is an upper eyelid lift, that may net the practice $2,000. Okay. So now you've got plastic surgeons who are going on record and they say, what do you think is hot for next year? What do you think they're going to say? They're going to say surgery. Oh, people are going to go to surgery because back in their mind, and maybe this is maybe they've repressed it. Maybe this is just kind of their subconscious coming out. They want to do more surgery. The interesting thing, Doug, though, is when you look at the statistics every year, the number of non-invasive procedures every year goes way up. And the number of actual surgery is either stable or very slightly increasing. I was reading an article recently, I think it was from Allure magazine, and it was the same thing. And they interviewed all these plastic surgeons, and what they say? Okay, they said filler is going to be replaced by facelifts and by fat injections. Botox is going to be replaced by brow lifts. It was all of these like non-invasive treatments that are going to be replaced by surgery. And everybody they interviewed were surgeons. So it's like, okay, come on. I think that we're going to see less of these overfilled faces because I think that we have seen a handful of celebrities recently who look absolutely amazing. And what have they done? I think one of the big things they've done is they have removed some of their fillers. They still have some filler, just not a lot of it. That's where I do think the trend is going to be. You see some celebrities like Lindsay Lohan, Christina Aguilera, Demi Moore, who just are like defying age, and they look amazing and they don't look plastic. But I think a big reason why is that, yes, I do believe most likely a lot of them, and those 3 may have had filler and they may have had surgery as well, but they're just not overdoing the filler and making them look like they got these big puffy pillow faces and like they're, storing nuts in their cheeks for the winter and that type of thing.
Yeah, I think we talked about this maybe in our first conversation where like I think the age of people who start to get filler has gotten, younger and younger, over the years. And it's kind of scary because it's like it's just like blatantly obvious, and B, I just think I don't think it's that attractive, right? And I think people end up regretting it later on. Like you said, a lot of these people are getting it removed because of that. Like as a plastic surgeon, like what are your fears of people getting like way too much filler at such a young age?
Yeah, I mean, it can be very distorting. Botox and fillers should be looked at very differently. Botox is a neurotoxin. You inject it into muscles of the face and it causes those muscles to not move, to become weaker for 3 to 4 months, and then it wears off, and then you kind of go back to where you started. Filler is different because the way I describe filler, it's like liquid skin. And so you're injecting a substance. Typically, they're made of hyaluronic acid, which is a naturally occurring moisturizer of the skin. And then you inject it either in the deeper skin or underneath the skin to add volume, to add, substance there. The main issue I have with filler, and I think the public sees when it's overdone, and when it's overdone, it can be distorting to the face. But even more of an issue that can be very, very serious is when it's accidentally injected into a blood vessel. Our face is filled with blood vessels. And if you inject filler and you clog, let's say, a small artery that leads to the tip of your nose or to your lip or to, let's say, your nostril, and that artery is clogged by filler, that part of your face may not get sufficient blood supply. It becomes what we call ischemic, where it starts having problems. There's not enough blood supply there, and eventually that tissue can die. So people have had injections of filler, and they've lost parts of their nose. They've lost parts of their lip. People have even gone blind from poor injections of filler. And so, yes, I think the cosmetic aspect, the good thing is you can always melt it away. And usually filler isn't so much that it stretches the skin that skin's not going to bounce back. But more important than that are the potential risks of filler when it's injected poorly and mistakes are made. Now, certain fillers, I mentioned the hyaluronic acid fillers like Restylane and Juvederm, there is an antidote to those fillers. And so if it's injected into a blood vessel and you start having issues, you can inject an antidote that can help to melt it away. But there are other fillers out there, Doug, like Bellafill, like Radiesse, that are not made of hyaluronic acid. They do not have an antidote. And if you accidentally inject it, and let's say into somebody's nose, and you get it into one of the blood vessels, and the nose starts to get pale, it starts to get painful, there's nothing you can do but pray to God that somehow that gets better. You can put warm compresses on it. You can put them in hyperbaric oxygen. But in the end, you're screwed. And it shocks me how many doctors are still using those products, knowing that there are much higher risks with them.
This episode is brought to you by Silver Biotics. If you're anything like me, you want to stay strong, live longer, and build a body that supports your best life. Hitting the gym, lifting weights, and pushing yourself is certainly a huge part of that. But let's be real, soreness and fatigue can slow you down. That's why I swear by Recover Muscle Cream from Silver Biotics. It's not just another muscle cream, and it's been a game changer for me. It's packed with clean, science-backed ingredients and can help ease soreness and can help speed up recovery. And thanks to the added magnesium and Silver Biotics' patented Silver Sol technology, it works deep to support muscle recovery without any junk ingredients. So whether you use it before or after your workout, Recover can help you feel stronger, move better, and stay in the game. Because remember, when you take care of yourself, you can show up stronger for the people that you love. Try it now at silverbiotics.com. And when you use the code Doug, you get 30% off your first order. Plus, Silver Biotics throws in some extra samples when you order directly from their site. So again, go to silverbiotics.com and use the code Doug at checkout for 30% off your first order. Now back to the show. I mean, do you think getting filler can become like an addiction and create body dysmorphia?
I don't think it would create body dysmorphia, but it can propagate it, and it can be an avenue for people with dysmorphia to do bad things to their body. So body dysmorphia is a psychiatric condition where somebody looks in the mirror and they see something different than reality. Just an example is Michael Jackson. I think he had body dysmorphia. He looked in the mirror and he saw a nose that he thought was very unattractive, and so he underwent multiple operations to correct a deformity that was never even there in the first place. So you and I, we may look at a picture of him from, let's say, Thriller and say, wow, his nose looks great. It looks like he's had a nose job. It looked fine, off the wall. It looks fine with Thriller. But Michael Jackson at that time may have looked at his Thriller nose and said, oh, it's too big. It looks terrible. So then he has more surgery. Then you see him in, let's say, Bad or some of those other, further albums where it's really getting whittled down. And to him, his reality is that he's still seeing this big nose that he finds unattractive. Whereas you and I are seeing, wow, there's not much left of that nose. It's so tiny. So it's really difficult. People with body dysmorphia, because their sense of reality has been skewed, but they don't often have insight into the fact that their reality is skewed. And that's why it's so hard sometimes to treat them. Have you ever connected with Ariel Laurie? You know Ariel? I know Ariel. Yeah, I did her podcast. Yeah. So she was on the podcast. And the reason I bring her name up is I think, she's open about a lot of the cosmetic stuff she's gotten done. Oh, yeah. Yep. And she came on the show. She's been on the show a few times. I don't remember when the last episode was, but she said that she asks herself I think a series of questions or something before she gets something done to make sure that she's doing, it for the right reasons. And I think it was a really important thing that she shared because, I think a lot of times when, if you're feeling like insecure about yourself and you're like, oh, like going and getting filler or Botox or some sort of surgery will fix my problems. And then you still have yourself to look at in the mirror and you're like, it's still not good enough. And I think that's where I think psychologically it can become a bit of an addiction because you're constantly having to fix yourself and just tell yourself that no matter what you do, nothing's good enough and that you have to figure out these ways to make yourself perfect, even though that's, a complete, allure. Yeah, I invited her to come onto my show. And so we're still trying to get that scheduled. But I think she's I really love what she is doing because she's putting her experiences out there without trying to hide any of it. And yes, she's had some work done. Some of it has worked out well for her. Some of it she hasn't been happy with. And that's something we have talked about, privately with her as well. So, it's tough. I think that as men in our society, we don't realize how hard it is for women when they transition from their 20s to their 30s and beyond. Our society is not kind to them. And there is an experience that a lot of women undergo that men just don't get, and I wouldn't get it if I didn't talk to 50 women a day, but men don't get that when women go from their 20s to 30s and 40s, that they start feeling invisible in society. There is a definite change that occurs as they get older that a lot of men do not realize and can be very painful. It can be very isolating and it can be very difficult for these women to go through it because society it's not kind and does not unfortunately pay attention, equally to women who are in their 20s, 30s and 40s and beyond.
Yeah. I mean, no, I totally hear what you're saying. And like, it was a great conversation because I got to learn, more about what it's like from her perspective. And then also I think it shedded light on some important topics as she shared her experiences and lessons learned with the audience. I'm getting into another, I guess, pain point for people. It's like flabby skin. I mean, as a personal trainer, a lot of the women that I've trained, flabby skin under the arms is something that the day one, they're like, how do I get rid of this? Right. And then men, a lot of times it's man boobs, it's love handles, stuff like that. So I'd love to take a deep dive into flabby skin for the pain points for men and women.
So the one thing that we cannot do non-surgically is get rid of excess skin. That's always been the challenge. So we have treatments. I mentioned to you before, Morpheus 8, which is a skin tightening treatment that I think helps for people in small areas, like let's say the double chin area. But when you do a same treatment like that, let's say on somebody's abdomen or on their chest or on their arms, where these are larger parts of the body, usually you don't see any results from those types of treatments. They are very disappointing, and they have been for the last 20 years that I've been in practice. The one place, so we can melt fat non-invasively. Amazing. Like, it's incredible. I would have never thought of this 20 years ago, that we can actually melt fat without actually physically removing the fat. But what we cannot do, unfortunately, is remove excess skin or cause that skin to shrink to a significant amount on the body that you can really notice it. And therein is the challenge with droopy skin. So for example, one of the things you mentioned is gynecomastia, is basically man boobs. If your skin is tight and you've got some fat there, well, fat can be reduced using treatments like cool sculpting. Sure, these are non-invasive fat reduction devices. But if it's, let's say, actual male breast tissue, okay, with gynecomastia, with the man boobs, then it's not fat, and those fat reducing devices aren't going to work. One of the interesting things that some doctors are doing with the chest that is a minimally invasive operation for men is you can combine what's called an arthroscopic shaver with liposuction. An arthroscopic shaver basically is an orthopedic device where, somebody, let's say, has some loose cartilage in their knee, they make small incisions, and they use this tiny little instrument with a rotating blade on the end that can kind of cut off some of that cartilage that's been shaved off or that's been, kind of torn, and it can shave that off and essentially smooth out those edges. You can do that also in a male chest. And so more and more doctors are doing that. I did that for many years when I was doing that type of an operation. So that's something that's kind of interesting. Otherwise, unfortunately, a lot of people you probably see are people who've lost weight and they've developed some loose skin. The skin may be hanging from their arms or their thighs or their abdomen. It's tough, Doug. It really is, because some people think, I get patients of mine who've had 3 kids. They've got loose skin hanging from their tummy, and their husband says, well, just do more crunches. That'll make that skin go away. No, it won't. It'll strengthen the muscles underneath it. But the way I describe it to patients, it's kind of like you have like a winter coat over your abdomen, and you can work those abs. You can have a 6-pack under that winter coat, but unless you take that winter coat off, you can't see it. And therein is the challenge. And so unfortunately, when you have excess skin where it's truly drooping, the only way to really treat it is to cut it out. There's one other option, though. There's a very interesting thing that's going on, and there's a treatment. So I'm talking about cutting out extra skin, and sometimes you have to cut out inches of skin, pounds of skin to get somebody the contours that they're looking for. What if you develop a device that removes skin in tiny, tiny amounts, such tiny amounts that it doesn't leave behind a visible scar, but then if you remove it in these tiny little columns, and you do, let's say, hundreds of them in an area, can you technically remove, if each column that you remove, let's say, is the size like 1 millimeter or 2 millimeters, but you remove hundreds of them, then that all adds up, and you can remove an actual quantity of skin that may not leave behind a scar. And that's the idea behind a treatment called Ellacor. Ellacor is being promoted right now as a no scar facelift, incisionless facelift. Some people even doing it on the body. And the idea is it's this handheld device we have to do in the office that has multiple hollow needles in it. And those needles are hooked up to suction. And you treat a person's skin with it, and those needles go into the skin. And as they come out, because they're hollow and they're hooked up to a suction, it will pull a little column of skin with it. And you do that hundreds of times. You're removing these tiny little columns because those little cores, those columns are so tiny, they won't leave behind a visible scar. And if you do it enough, the idea is that you can remove skin that way without visible scars. It's a really cool idea. But the problem right now, Doug, is it's painful. It's bloody. It's a bloody operation. Even though you're not, cutting, you still are kind of cutting. And the results that I've seen so far have not been all that impressive. But I think it's a good idea and something that hopefully in the future may be an option for people like you're talking about who've got excess skin and maybe they don't want to have, a big surgery to cut it out. Can you remove that skin minimally invasively and still get a nice improvement and like no visible scars afterwards? I think my hope is that we'll get there. We're on our way, but we're just not quite there yet, in my opinion.
Yeah, and I think when people have come to me over the years, it's like they want to lean out. What that means is they want to feel tighter, right? And they want their skin to be a little bit, tighter, and they don't want as much like, loose stuff like roaming around or whatever. I mean, do you think a good overall first step though is like reducing body fat and building muscle to see where that takes somebody?
No question, but I think you have to also be realistic in that, you've got layers of the body. You've got the skin on top, you've got subcutaneous fat below that, and then you've got muscle and the overlying fascia below that. And all of those are kind of separate, So yes, when you're doing crunches or you're doing muscle, you're doing resistance training, then those muscles, that third element is getting stronger. It's getting bigger, but it's not doing anything necessarily for the top two elements, the skin and the fat. If you're at a calorie deficit, if you're, doing things to lose a percentage of fat, then by all means you can thin that fatty layer, but thinning that fatty layer is not going to have a tightening effect on the skin. And so each of these you have to kind of look at physiologically that they're very separate entities and they are treated very separately as well.
Is it possible to get rid of stretch marks after you lose weight?
You can't get rid of them unless you cut them out. There are treatments that can make them look less apparent. So if they're early stretch marks, like let's say they're still red and maybe even a little itchy, then there are laser treatments that can help to reduce some of the redness. Those same lasers can help to reduce a little bit of how thick they are because stretch marks are essentially tears in the deeper skin where you've got the thin skin layer above it and you get tears in the dermis, which is that deeper skin. And there are treatments, laser treatments that can help to tighten up that thin layer of skin above it. Overall, that can improve the appearance. It can definitely reduce the redness, but there's no treatment other than cutting them out that will make them completely disappear. There's no like eraser for it. If you don't have access to a dermatologist or a plastic surgeon, these types of treatments, yes, there are things you can do at home. You can apply a retinol cream to it. You're going to see very, very minimal changes with it, but at least you're doing something with it. Some people may try things like red light therapy. No sign to show that's going to do a lot with them, but once again, it's not going to hurt.
Right. And what about cellulite? Is there a way to reduce that naturally?
Well, cellulite is a bit of an inflammatory process. And so essentially what it is physically is you've got the skin at the top, you've got subcutaneous fat below it, and then you've got these fascia, which is a covering of the muscle, and you've got these little fibrous bands that go from the fascia up to the skin. And when you are inflamed and that fat gets puffy, like let's say you eat a meal, at a Chinese takeout place or something like that, you're, let's say, binging or something, then yes, that fat can get puffy. It can, get inflamed and filled with fluid, and that can cause those dimples to get worse. And so the first thing that you want to do is you want to go towards more of an anti-inflammatory type of diet. You can combine that with massages like lymphatic type massages. That can help to kind of push that fluid out as well. And those would be the simple things to improve cellulite. Now, I tell you, it's like 80 to 90% of women have cellulite and only like 5 to 10% of men, just because of our anatomy and how the fat layer and the muscle layer and the skin interact with each other. And so having cellulite, especially in women, is very common. There's nothing wrong with you. It's not a deformity. It's just it's a normal state. And yes, you can improve it by doing things like that. Dry brushing can help, long term with that type of thing as well. And that's going to be kind of that massaging part of it.
One of the solutions that you hear a lot about, you've talked about it a bunch, is collagen for the skin. Talk about the benefits of taking collagen for skin health and for anti-aging. And then I know you have your own supplement line. Talk about like what separates like yours from going into like a convenience store and buying one.
Yeah, so the big thing with collagen is it composes 70 to 80% of our skin. And when we're in our mid-20s, we start to lose collagen. It's about 1% a year for most people. Interestingly enough, there are some studies showing that women after menopause, in the first 5 years after menopause, lose 30% of the collagen of their skin and about 2% afterwards. And so this loss of collagen is a big deal. Now, collagen is a large protein. So just applying a collagen to your skin isn't going to do anything because the skin is just going to sit on the surface of the skin. And so the way to really replenish your collagen is twofold. You want to definitely get enough protein in your diet because protein in your diet contains the precursors to create collagen. And if you're not getting enough protein, then that obviously will not benefit your collagen kind of regeneration. And then I'm a big fan of collagen supplements, like you mentioned. You know, we've got our Youn Beauty supplemental collagen. It's our number one selling product in our entire Youn Beauty store. And there are a lot of studies, meta-analyses of thousands of people who've taken collagen find that if you take it for a few months, that there is an increase in the thickness of collagen in your skin. So I'm a firm believer in that. There are a lot of places that sell collagen. There's a lot of companies that have it. You know, I think the important thing when you're looking at collagen, ideally, like when you're looking at your food, you want to choose one that is high quality. Just like when you're looking at meat, you know, you can get cheap meat out there. You can also get cheap collagen. And so just make sure that it's sourced well. Ours is called Verisol. There's a lot of studies behind Verisol. It's type 1 collagen that's in your bone, hair, skin, and nails. That's ideally what you want to look for. And then ideally you want one that it ideally is hydrolyzed. So it's broken down into a powder that can really be absorbed very easily by your gut. So you want to look for hydrolyzed collagen peptides. Verisol is a very proven one. That's what's in our brand.
Any other like staple supplements that you think everybody should take every single day to reduce aging and to have their skin look their best?
Yeah, I think there's a basic supplements that I think are great for everybody. And so taking a multivitamin every day, and I do that. I also have my Nutrafol that I do as well. Also taking an omega-3 supplement to reduce overall inflammation, I think is important. So that's something I would recommend. If you are vegan, then there are algae-based ones I think that are fine. Otherwise, fish oil definitely is what I would recommend. I also recommend a daily probiotic. You know, there's so much information about how important our microbiome is and the health of our microbiome. And so supporting that with a daily probiotic, I think, is key. And then the final thing that I would recommend for pretty much everybody would be to take an antioxidant mix. Antioxidants fight free radicals and oxidation. So many of the good things that are in our fruits and vegetables are antioxidants. And so why not supplement it with a good mix of antioxidants as well?
So if somebody goes to your website and they're perusing through like your stuff and they go to your store, you talked about like the collagen, you've mentioned serums and stuff and Nutrafol. Like, is there anything else you would like people to be interested in when they go to your website?
I think that when you're looking at anti-aging and skincare, if you're on a budget, then start with retinol unless you have really sensitive skin. There are a lot of skincare brands that have retinol. So if mine, let's say, is too expensive for you or you want to get it at your local drugstore, then that's fine. Just make sure you try it. But if your skin is really sensitive, retinol may not be the best thing because it can be irritating to some people's skin. In that situation, look for peptides and or bakuchiol. One of our most popular products is our peptide and bakuchiol moisturizer. There was one study that compared bakuchiol to retinol and found very similar anti-aging effects. And peptides are basically just small chains of proteins that act to stimulate your skin to create collagen. And we've talked about a lot of collagen already, but anything you can do or apply to your skin to help it to create collagen, that's the way to go. What you want to avoid, though, are collagen creams because applying collagen to the surface of your skin is not going to replenish the collagen, but you want to give your skin those products that will help your skin to stimulate its production on its own.
Any other pain points you hear a lot about as a plastic surgeon that you think people should be concerned with regarding their skin and aging and how they look?
The hard thing is there's so many things that are so expensive. You know, you can get fractional lasers, even Morpheus 8 I mentioned earlier. These treatments are very, very expensive. If you don't have access to that or it's outside your budget, the one thing to start out with, other than these skincare products, which I think those are the basic thing, but look at maybe getting a red light mask. There's so many red light devices out there that I think are great. And essentially it's like taking the dermatologist home with you. No, it's not going to be quite as powerful as, let's say, getting a full face fractional laser, but at the same time, it's much safer than that. And it is much, much more economical. And I think everybody should be able to red light their face or parts of their body at home. You know, sometimes it can be as little as a few $100s. And those devices hopefully can last you many, many years.
I know you love talking about trends and stuff not to do. Anything you've seen over the last couple months, either on TikTok or any other version of social media that you're like, oh, this is so dumb, people should stay away from it?
Oh, let's see. Well, I think right now the interesting trends is I think that we are getting to trends with our food and with our skincare and our products where we are realizing actually that our government has allowed a lot of things both in our food supply and in our cosmetic supply that maybe other governments don't. And so that's, I think, that's a huge trend right now that people are realizing that there may be a lot more that we have chemicals that are unnecessary, additives and preservatives. I think that's actually overall a good trend because we do want to make sure that anything that we put in our mouth and that we put in our bodies and that we put on top of our skin is as safe as absolutely can be. And so the interesting trend right now, I think, is actually a good one in that there are people who are shining a light on this type of stuff. And then there are those people who are poo-pooing it. You know what? If we can make our food and our products safer and healthier for us, there's no downside to that. Why not? That's my feeling with it.
Dr. Youn, thank you so much for coming back on the podcast. I really appreciated all of your insights, and I think the audience can get a lot of value out of this.
Thank you so much, Doug. It was a lot of fun. I appreciate you having me back again.
You got it.
Thank you so much for watching. If you like this video, I really think you're going to like this video as well. I'll see you there.